Hey, friends, welcome to the Well Mind Podcast, a space for meaningful conversations about a broad range of wellness related topics. I'm your host, Dr. Ben Coles. I'm a clinical mental health counselor and counselor educator. This podcast is really my effort to bring free and open access content on health and wellness for everyone. I hope that by tuning in, you discover new and meaningful ways to think about your wellness and take away some actionable information. If you're new to the podcast, welcome and thanks for joining us. If you're a returning listener, then welcome back. It's great to have everyone here. I've got a few conversations lined up, so I intend to put out more episodes in the coming months. So be sure to subscribe through your app to get the latest episodes when they're released. All right, let's get into my conversation with today's guest, Denise Schoenwald, a dedicated registered nurse for over 30 years, has seamlessly transitioned into a licensed mental health counselor and published author. She's based in Sarasota, Florida, sees clients locally, but also across the nation through her telehealth platform. With a deep understanding of the emotional challenges faced by patients and their families, Denise's holistic approach integrates mental and physical well-being. She's also a certified family mediator and brings a unique perspective to her private practice, offering support to clients nationwide. Denise is committed to nurturing both body and mind, providing flexible and accessible care for individuals, couples, families, and even young thinkers starting all the way at age 4. In our conversation, Denise shares a bit about her journey from nursing into counseling and how she uses her training and knowledge from both fields as she serves her clients presently. We dive into the deep connections between our physical and mental health, and Denise shares some thoughtful insights on how we can approach our wellness from a truly holistic perspective. So please join me in welcoming Denise in episode 40, Connecting Mental and Physical Health. Welcome, Denise. It's so wonderful to have you on the Well Mind podcast. I appreciate you spending some time with me this morning.
Thank you. Enjoyed being here. Thank you for the
Yeah,
invite.
yeah, absolutely. So, um, I always like to just start off with having you do a little introduction of yourself, just so that our audience can get to know you a bit. So, Denise, we were just talking before I hit the record button about our Florida connection,
Mhm.
um, but I know that you've only been in Florida for 15 years, which is quite a while, but there's a
Mhm.
lot of life to live before that. So, just tell us a little bit about yourself, kind of some background, and what you're up to these days.
Well, I was born in New Jersey. My dad was an airline pilot. He flew out of Kennedy. So I lived there my
Awesome.
first 20 years, then moved
Hmm.
to Maryland. And
Hmm.
I was a registered nurse in Maryland, worked in critical care for many, many years. And then the last decade or so, we moved down to Florida and I went back to school to become a mental health counselor. So I see clients locally here in Florida as well as nationally. So clients all over the
Mm.
United States.
Yeah. And certainly the expansion of telemental health services has been a huge benefit to being able to reach folks that maybe don't have the opportunity to just drive down to their local outpatient office or something like that. So it sounds like that's something that you've invested some time in getting expertise in.
Yes, yes. It required me to take a second set of boards, but it was well worth it to have a national sort of coverage of mental health. I feel like it's so important.
Yeah, yeah. So I'm curious. This was kind of the first thing when we got connected. I was like a background in nursing and critical care. You said
Mhm.
um, that's not a field for everybody. Not everybody chooses to work in that kind of an environment. It's very intense. There's a lot of stress. You're seeing people in some of maybe the worst moments of their life, those kind of things. So I'm really curious, just what was it about that profession, or maybe what led you in your life experiences to even pursue that kind of a helping profession?
One of the things I still love about nursing is the body is so sophisticated. And when patients would come in with various symptoms and ailments and pain, there's always a reason. It just doesn't happen. And the more that you practice medicine, the more you realize how to really sort of tune into the body. And I love that. Obviously, with critical care, people are just at their worst. Families are really stressed and struggling. Obviously, the patient's not doing well. And I really enjoyed not only working with the patient, but also being a liaison with the family and just sort of helping with that sort of entire experience, which could be so traumatic, but yet very, very healing and helpful for a lot of families too. And I really enjoyed all aspects of critical care.
Yeah, yeah. I have a background working in a hospital system as a mental health counselor, but I was working alongside a lot of nursing staff and
Mhm.
technicians, and we oftentimes provided services in other parts of the hospital. And so I got to cross over into like the neonatal intensive care unit, working with some families there, and so there's this idea of family centered care rather than
Mhm.
exclusively patient centered care. And it sounds like that's something that was really true for you from the onset of your helping work.
Yes, I really enjoyed it for many, many reasons. Although, as I started to get older, nursing and being in the hospital can really be tough with
Mm,
being on call, long shifts, lifting people who are twice my size, and so
mm,
forth. So, when I decided that I wanted to do a second career, I really wanted to use my critical thinking and assessment skills, but I didn't really know how to do that. And
mhm.
I met somebody that was going back to school for mental health counseling, and it just seemed like the perfect fit.
Yeah, yeah. Um, so that's not an easy process. I mean, for myself as a counselor educator, a lot of students that I work with are second career, or some are even third career, right? They're
Mhm.
recareering again. Um, and so I'm just curious what it was for you. It sounds like you were loving the work that you were doing, but it was also at a cost to you personally.
Mhm.
You say, I want
Mhm.
to keep helping. So, what was it about specifically about mental health and that kind of work that drew you into this field?
Well, one of the things that I think a lot of people might not realize is that mental health is actually a science.
Mm,
And obviously, medicine is a science too. And at first, I thought, well, what will I do as a counselor other than listen to people's problems? And I thought, there's got to be more to it than that. And the more that I really sort of transitioned into mental health, I realized to bring the science of why somebody has anxiety, why they're struggling with depression, and incorporate that into their physical health, their spiritual health. And so for me, it was sort of exactly what I was doing, but just in a different realm, if you will.
yeah, yeah, yeah. I would imagine working in critical care that, I mean, obviously your focus is on the body, on the
Mhm.
physical, what's going on, what's going wrong with the
Mhm.
body, and introducing some treatments or interventions to facilitate healing in the body. Um, Now, when I think about counseling, I oftentimes have that same paradigm. Like our mental health is influenced by so many different factors. But when dysfunction arises, again, there can be a number of different causes or influences for that. But being able to identify or locate where some of that dysfunction is happening to introduce some interventions or treatment to facilitate health and wellness and healing is really the same general approach that many counselors take in that process. But you can't see it, right? That's the thing. Like
Mhm.
medicine, you can administer something, you can operate, right? There's like
Mhm.
something that you can see that's happening. So that's kind of a leap, right? There's a bit of a jump to say, okay, we're going to
Yes.
start doing these things, um, it's not as visible. So I'm wondering kind of what that just that transition was like for you, because the nurses that I know, they're very active, right? They're very engaged in like, this is what we're doing. Even sometimes when the patient is like, I don't want to do that, like, nope, this is what we have to do,
Mhm.
right?
Yes.
But counseling, it's you know, you've been doing this for a while.
Mhm.
It is a slightly different tact. So how did you make that switch?
Well, you make a very good point. In critical care, you're basically just fixing. You're trying to fix. You're giving medication. You're seeing if it's working. The problem is already in front of you, and you're doing everything that you can to correct it. With mental health, yeah, we have to realize that things are just manifesting. They're starting to feel obviously they're coming in with some sort of problem or something they want help with, but it's also you have to be very careful with how you approach it because many times we have struggles that we just hold in the body and we're a little bit reluctant to let that out, if you will.
Mm. Mm-hmm.
So I rely a lot when I'm working in counseling on energy. I'm asking certain questions and I'm watching the body and watching how they're responding to see if it's a good time or maybe this might be a good lead in to go to something a little deeper or maybe not.
Mm-hmm. 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 Yeah, that was one of the things in my training that has stuck with me, and that's y- we obviously respect clients, right? We
Mhm,
respect their agency and their autonomy and their ability to make choices. But I had a supervisor that said, and we also respect their defenses too.
mhm.
And so that I got a hint of that in what you were talking about. That there's sometimes when you observe something or you notice something, but you still have to discern: is this the time that I should pursue it, or is this something that I wait on, that I step back from?
Yes, yes, and if I
Yeah.
use my nursing approach and I push that,
Mm.
then it's not no longer really healing or helpful.
Mhm. Mhm. Yeah, so you use this phrase like the body's holding something.
Mhm.
Can you
Yes.
unpack that for me a little bit? When you think of the body holding something, what does that mean or look like to you?
What happens when we experience maybe a trauma or something difficult? Maybe abandonment, maybe some sort of fear, maybe some sort of inferiority, whatever that looks like. These experiences are something that we feel and then hopefully learn from or get some meaning from, and then they should really sort of exit the body. They're no longer needed.
Mm.
But for many of us, we experience that and we hold it because we think, I might need this. So we
Mm.
develop this armor of a lot of emotions or situations that have happened to us, and they will bubble up in really tough times. Or if they we have a lot of them, they'll come through no matter what's happening.
Mm.
We may have a situation that's just very neutral, and all of a sudden we're thinking the worst because we're holding a lot of emotions in the body that we never really processed or healed
Mhm.
from.
Mhm. Mhm. Yeah. So when I think about like hearing what you're saying, that there are sometimes patterns or ways of being that develop based on past experiences,
Mhm.
but they haven't necessarily been something that we've intentionally chosen to say, oh, this is how I'm going to approach this situation when I
Mhm.
encounter it. But it's almost reflexive at that point, like muscle memory.
Yes,
Like, oh, I feel this way, and so this is how I react
right.
to
This
it.
means that, and yet
Mm.
it might not mean that, but
Mhm.
because I've held this and that's sort of the channel that I'm taking, I know that when this happens, this means something, I call it dark, something painful, something very
Mhm.
fearful.
Oh, yeah, yeah. Well, let's go there. Like when you're working with clients, like What's an example of something that like make this tangible for us in this conversation? Like, what is that? What is something that somebody might be holding that then is reflexively influencing or guiding their
Mhm.
behavior or their choices?
Well, a lot of times people don't even realize that what they're holding.
Mm,
They'll say, I'm exhausted all the time. I procrastinate. I have no energy. And I can't really figure out like what it is.
mm,
Why is that happening? So I actually have a stack of index cards, it's like 40 emotions, difficult emotions. And
mm,
so what I'll say is, listen, I'm going to show you these 40 emotions, and I'd like to know if you struggle with them: inferior, anxiety,
mm,
sadness. And so I flip through them very quickly and I say, this is something we're just going to learn from, because I don't want them
mm,
to sort of get worried about it. And then at the very end, I show them, I say, unfortunately, you're holding a lot of these emotions in the body. And this gives them sort of a visual of how many they're holding. And a lot of times they're a theme.
mm,
Gosh, most of those that I said yes to came from my childhood
mm,
or my divorce
mm.
or something that happened. And then we can start to unpack a little bit when we have a better understanding of what they're struggling with.
Yeah, yeah. That's it's a very gentle process
Mhm.
of inviting
Yes.
that person to look at those emotions. I get the sense that we're really good at avoiding
Mhm.
as just as human beings. If it's unpleasant, if it's uncomfortable, if it's painful, um, the avoidance is a very common response to that.
Mhm.
And so you just introducing these kind of words on a card, right, um,
Mhm.
is a gentle way for them to see it maybe externally before they acknowledge it internally.
Yes. And you would be amazed at how many people they can't identify it. I'll say
Mm,
inferior, and they'll go, I don't know. I don't
mm,
know. And he's like, well, do you feel inferior around other people? Do you feel like you're less than? Not sure. So that
yeah,
tells me that a lot of these, they're not even aware. Okay, so these feelings may or may not be in the body, may or may not be causing a lot of problems, and they can't even quite connect to them.
yeah, yeah, yeah. But we need language to be able to connect with them,
Yes.
and so it starts with introducing some of those words for sure.
Mhm.
So we've just kind of zoomed in a little bit here, and now I want to zoom back out because what we're talking about is really this idea of health and wellness,
Mhm.
and when there's been a disruption to that, when dysfunction is happening, and we're not addressing it, it can linger. It can influence even outside of that single situation, like you said, oh, my childhood or a divorce or something like
Mhm.
that. Like we can maybe point to specific events, but we say that's in the past. That's not really
Mhm.
affecting me now. When what you're saying is that, oh, we're still holding emotions, we're still holding experiences from the
Mhm.
past that are influencing our present. So those are disruptions to our health and wellness. And you use the term holistic
Mhm.
as you're describing our health and our wellness and your approach. So that's where I want to zoom out and say, well, okay, if we're looking at this holistically,
Mhm.
first of all, what does that really mean, and why is that important? That perspective important from your
Mhm.
view?
And I think a lot of people feel like wellness is physical wellness. I go to the gym and I try to eat right and so forth. But what I've learned now that I'm primarily focused on mental health is our emotional health is what will eventually manifest physically if we're not balanced.
Mhm, mhm,
What we many times sort of forget about is the spiritual part,
mm,
our belief. When we don't have any sort of faith in anything, we put a lot of pressure on the body to control, to figure things out, and it really stresses the body physically and mentally when we have to sort of hold the weight of the world on our own shoulders. I
Mm-hmm.
think a lot of people confuse sort of the spiritual with I don't want to be a religious, and it's
Mm-hmm.
not necessarily a religion. Of course, it could be, but it's more of trusting the universe for experiences and for faith, and to sort of let go and realize that we're not in this alone.
Mm-hmm. Mm-hmm. So, yeah. So wellness, like you said, I mean, and this is just, I think, culturally for us,
Mhm,
in so much is importance, and in some ways rightly so. Like we do need to get uh, physical activity and exercise and
mhm,
move our body. And that's really healthy and helpful. And so often in the counseling room, those are topics that we're talking about as a pathway toward mental wellness, nutrition and sleep.
mhm,
All of these are really important physical aspects. But if that's just one domain, and so there's a spiritual domain that you're referencing
mhm,
here in terms of a spirituality, a belief
mhm,
system, a appreciation and understanding of things outside of ourself and our
mhm,
singular being. Um, Another one that we're talking about too is emotional health, right? Emotional awareness, emotional competence to be able to recognize and access those emotions in a healthy way. What are
mhm.
some of the other domains that you think about when you think of holistic wellness?
Well, I when I do my first one initial meeting, I'm asking things, for example, friends. Do you have a good network of friends? Because again, I'm wondering like what are they doing to sort of balance body, mind, and spirit? Like what are
Mm,
are you religious? What are your hobbies? I
mm.
can't tell you how many people say I don't have any hobbies.
Yeah, yeah,
And so then what I'm looking for is, are they smoking, drinking, eating? Because some way the body's trying to get relief.
yeah.
And so I'm bringing in a lot of questions that they a lot of times wonder why I'm asking those questions, but I'm really understanding again a holistic picture of what their life looks like, how whether the nervous system is balanced, and if it isn't, what are they doing for relief? Because we're going to
Mm.
do something.
Mhm. Yeah. Yeah, we don't like to be in a state of dysregulation, and so
We
there's
do not.
oftentimes, yeah, sensation seeking to as a way of soothing, that
Mhm.
dysregulation and trying to re-regulate, and you'd referenced, substances and food as, just a couple of, methods
Mhm.
that we all, at some point, use to regulate emotion.
Yes.
But you're also talking about, social and relational,
Mhm.
health and wellness, like, that's another domain within this holistic picture, is that we are not, on an island, right? And when we're isolated from others, that, impacts and certainly influences our physical and mental, emotional, spiritual wellness as well. So
Yes.
all of these are seem very interconnected, and what you're trying to do is, create this holistic picture, this
Mhm.
image of who this person is, and through that understanding, develop some pathway or a way of
Mhm.
navigating, uh, maybe through some of the difficulties that they're having.
Yes, I'm trying to get a very good understanding in a very small amount of time of what's going on. Is the nervous system overstimulated? And if
Mm.
so, what are they doing for relief?
Mhm,
Because we will go
mhm.
for relief. So what does that look like? And what's going on now? And how long has it been going on?
Yeah, yeah.
And
Yeah, you've referenced the nervous system a couple of times, and
Mhm,
obviously with your medical,
mhm.
background, that is noteworthy to me. So when you think about the nervous system, like, what are some of the, basics that you're thinking through in terms of dysregulation versus regulation?
I think an easy way to explain it is the body's always trying to stay in balance. Physically, we see that in the hospital, we're really hot one minute. Next thing you know, we start to sweat. It's cooling the body down. So a lot of times physically, the body will sort of do it on its own, which is nice.
Mhm.
But mentally, we have to balance between what we call sympathetic nervous system, when we're doing and we're answering emails and we're driving and so forth, with parasympathetic.
Mhm.
Parasympathetic is just being,
Mhm.
it's going out in nature, maybe if
Mhm.
we're religious, maybe praying, meditation, hobbies,
Mhm.
painting,
Mhm.
music. These are all ways, even being with friends sometimes can put us in parasympathetic. And if we're not in balance, the mind will become very active. And the mind, then we notice that all of our thoughts or most of our thoughts and emotions are very fearful. So it's a good indicator of all of a sudden the body's not quite in balance as far as the nervous system. And without even realizing it, we'll go to the refrigerator and we'll go eat, regardless of whether it's interesting to watch, or maybe the phone rings and I'm instantly annoyed.
Mhm.
Bodies are out of balance, and I'm starting to show symptoms of that by how I'm acting or what I'm doing.
Mhm.
So
Mhm.
I try
Mhm.
to teach clients to be aware of, not to judge, but be aware of what they're doing and why.
Mhm. Mhm. Yeah, so often things happen by rote or mindlessly without thinking.
Mhm.
And like you said, in many ways, physically the body doing that, like we don't have to think about, oh, like I'm hot, so I need to sweat, right?
Mhm.
So I'm gonna
Mhm.
do something to make myself sweat. No, that just happens automatically. And that's a beautiful part of our design
Mhm.
physically.
Mhm.
Um, but what you're talking about are things that we do have choice with, things that
Mhm.
we do, um, it's gonna happen, but you are trying to bring some intentionality to
Mhm.
it. Yeah.
Yes, because life is going to different things that happen in our life are going to throw our nervous system out of balance.
Mm,
Somebody's maybe going to pass away, maybe if someone in the family gets sick, but unfortunately, a lot of us, our mind will keep us out of balance.
mm,
So maybe nothing really is going on that is going to throw us out of balance, but our mind is interpreting messages that are causing the nervous system to become very bad balance because the body is being cued by the mind.
mhm, mhm. The body is being cued by the mind.
Mhm.
It seems really important in this conversation here
Yes.
because so much of our maybe the way in which we approach things or the way that we think about things is that uh, things happen to us physically or within our environment, and then that affects our emotional state or that
Mhm.
affects our mental well-being. um, there's something like I break my arm and I can't I can't type or I can't do the physical exercise that I like to do, and now I'm suffering mentally because of that. Like,
Mhm.
so now, we think about that chain of events going that way, one kind
Mhm.
of one direction, but what you're saying is we need to recognize and place importance on how our mind, it's like more downstream, right?
Mhm.
In
Mhm.
terms of its influence.
Mhm.
Um, how, first of all, just how hard of a sell is that for folks when you're seeing them? Because it's a very different way of thinking about things.
Mhm. Well, what I try to give them is an easy example. I'll say, you ever around somebody that you're not sure that you trust? You don't know why, you don't really have any proof, but there's something in your stomach that makes you feel uneasy. And they'll say, "Yeah, I've had that before." And I say, "Okay, well, that's actually your body picking up energy, and that uneasiness is sort of being played out by by the stomach not feeling so great."
Mhm,
Or grief. If you've ever really experienced grief, the heart is so heavy, and you think, "Well, there's nothing wrong with my heart," but it certainly feels like that because the energy around the heart, is very low, and you're really struggling. And so
mhm,
I get them to connect that emotion with that feeling in the body, and then I start building from there.
hmm, mhm, mhm. Yeah, and those are, I mean, universal type experiences, right?
Mhm.
We've all had that pit in our stomach where it's like, "Oh, something's not right here, something's off," off, and so we, this idea of like trust your gut, right? That's
Mhm. Mhm.
just a common phrase that we use in everyday language. But that comes from somewhere, right? That
Yes.
there's an this idea behind it that our body does cue us.
Mhm.
But even before that, like recognizing that there's an emotional state that we're in
Mhm.
too. That sympathetic, more
Mhm.
activated state.
Mhm.
Sometimes people refer to that as like a fight, flight, or freeze type state when it's very elevated.
Mhm.
Um, that's our warning system is going on, but
Mhm.
typically, we're not walking down the street and there's a lion in the bush that's going to jump out at us,
Mhm.
and that's not what activates it, but it's our own thought process or our own emotional state
Yes.
that actually kind of throws us into that activated
Mhm.
nervous system state.
Mhm. And if you sometimes listen to how people communicate, you can see how quickly they are starting to spiral. Like,
Mm,
"Oh, have you been able to find a job?" "No, because if I get this kind of job, this is gonna happen and I won't be able to get there." And they just take it to such extreme where they haven't even applied for a job yet.
mm,
And
mhm,
it's amazing sometimes if we don't discipline the mind, how it takes off. And can you imagine what the poor body is trying to do to because the body thinks all that's true.
mm,
So the body's really starting to scramble. We're releasing a lot of cortisol and so forth. And what happens when we do this chronically is I sort of think of it as a thermostat. It's broken.
mm,
So things will come to us that maybe we should be concerned about, and maybe we're not because we're constantly in fight or flight.
mm, mhm.
Seen that many times.
Yeah, yeah. So talk me through a little bit about how you approach reworking that process, because if this is a pattern that's developed for someone, and they're recognizing it, maybe they're noticing it, they've done some work at this point, or
Mhm,
they've been sitting in reflective thought on this and saying, yeah, I don't like this pattern, right?
mhm,
This isn't helpful. I'm constantly on red alert.
mhm,
um, what are some of the initial ways that you get people to walk back from that, or to start to re-regulate? Because
mhm,
right, substances and food were kind of the no nos in some ways
mhm,
that you were saying,
mhm,
yeah, it works, but not it's not an effective or efficient way of doing that.
mhm. Well, one of the things that I do even before I get there is when I find out how they're doing physically. So maybe they're already starting to manifest some sort of physical problem, high blood pressure, diabetes.
Mm,
Certain emotions will wreak havoc on certain parts of the body. So if it's starting to manifest physically, I know they've had it for a long time. So it's just a quick way of understanding if this is new or this is now already started to sort of again exacerbate into the body and so
yeah.
forth. And when I ask about self care, as a society, we're terrible with
Mm,
self care. And so now I'm trying to incorporate little things that they can do. One of them is reframing.
mm,
I mean, that's an easy one, but it's amazing, to sort of stop that pattern of these dark emotions that we're catastrophizing a situation when we really have no understanding.
mhm,
The example that I give patients is I say, I was a critical care nurse. And I say, and when patients would come in, we would hook them up to the cardiac monitor. And I said, and all shift, those monitors would alarm. It just happened all day long. They were just alarming, alarming. And I said, and when they did, I didn't go get the crash cart. I went in, I took a look. Maybe we had to get the crash cart, but maybe they just reached for something and disconnected a lead, and therefore the alarm is going off. I said it's the same thing when we come up with a thought or a situation. We have to evaluate it before we make it into a crisis.
yeah. You need to get that information first, and
Yes.
really understand the
Mhm.
situation before you can respond to it, right?
Yes. Yes.
And what you're saying is in many ways, we're reaching for the crash cart every single time when we're in
We
that
are.
elevated state.
We are. Because we're imagining the worst possible scenario when likely that's probably not gonna happen. It could
Mhm,
happen,
mhm.
certainly, but and if it is going to happen, there's not gonna be a whole lot that we can do about it. You know, I say it's almost like being in a sailboat. The wind is gonna come, and we're gonna have to adjust the sail, but we gotta wait to see what's coming first.
Yeah, yeah,
If
yeah.
it's a hurricane, you know,
And
it'll be a little
you
tough.
know something about that being in
I
Florida.
do.
Yeah, yeah, yeah. But those don't usually creep up on you. Usually there's advanced warning for it.
Mhm,
Um,
mhm.
Unfortunately, life situations are not always like that, and sometimes just really challenging, difficult, painful things happen. Um,
Yes.
but if we're constantly thinking that, if we're constantly kind of steeling ourselves
Mhm,
to brace for that catastrophe, like you're saying, it's exhausting, it's
mhm,
fatiguing, physically, mentally, emotionally.
mhm,
It impacts our relationships.
mhm,
Um, so it's like you're hitting a pause button with them and
mhm,
saying, let's get some information on this situation.
mhm,
Let's look at it, examine it, and then we can determine is this the hurricane?
mhm.
Or is this something that we need to adjust our sails with and
Yes,
approach it from a different tact?
yes, and what's reasonable? A lot of times we
Mm,
feel like we need to go in and conquer it when it's
mm,
not something that we can do.
yeah.
If we are in generally fairly mentally healthy, maybe a crisis or a catastrophe will happen to us, but we will recover faster if or sooner and heal and in a much in a less amount of time if we are already fairly healthy.
Mm,
So the example that I give to people is if you had to have major surgery and you were a pretty healthy weight and you took care of yourself, maybe you exercise and so forth, you'll likely do very well. If you're overweight, you smoke and you drink a lot and so forth, you may have some complications because you're
yeah.
already not in a good state of health and now you have to have major surgery.
Yeah. Yeah. Yep. Yeah. These risk factors, these protective factors that you're talking about, um, are again, we're educated. We know about these things from a physical standpoint, but
Mhm.
I don't know that information is as accessible or readily published or
Mhm.
taught from a mental standpoint. So um, when you approach or you're thinking about these protective factors for our emotional mental wellness, what are some of the things that you're thinking through that would help us weather the storms when they do come?
Mhm. Well, certainly if whatever we're thinking about automatically we're fearful, we're anxious, we feel guilty, we're we're angry and so forth. I try to help clients hit the brakes a little bit and sort of think that through. Like, what if this happens? And I go, well, what if it does happen? Like,
Mhm.
what would we do? I mean, obviously, again, if it's a catastrophe, we're going to have to, pray to God and hope for the best and hunker down as we do for hurricanes in Florida.
Mm,
But we really put so much pressure on ourselves to fix and make sure everything is controlled and make sure we're at peace. And sometimes it's just not going to happen.
mhm,
And so we have to really sort of realistically look at what we're capable of. Perfectionism is another one where everything has to be perfect. It has to, and we put such pressure on ourselves to be perfect. Yet some of the greatest lessons are when we're not so perfect.
mm, mhm, mhm. There's a element of acceptance in what you're saying,
Hmm.
and that's oftentimes challenging because we don't want to weather the storm. We just don't want the
No,
storm, right? We
no,
don't want the
we don't want
bad
to
thing to
suffer.
happen. Mhm, mhm. But fighting against that or trying to control things so that it doesn't happen. Um, like you said, like there's just some things that are outside of our control. So being able to focus in on or refocus on the things that are within um, our purview, right?
Mhm,
Within
mhm,
our ability to influence,
mhm.
um, is a much more manageable and healthier way of approaching these situations. Again, I want to zoom in here and
Mhm,
like let's make it like really tangible, really clear. I don't know, maybe if there's situation from your own experiences that resonates,
mhm,
or from some of the people that you've served, like what does that look like? Kind of shifting that focus when I'm like trying to control these things, but really I need to step back from that. There's some things I need
mhm,
to accept, and
mhm.
at the same time, yet here are some things that I can have some influence over.
I think something tangible that might be helpful for people who are listening is when God or the universe is trying to teach us something, like we need to grow, we need to maybe make a different decision, and so forth, it has to be presented to us with a little bit of suffering. Certainly not punishing, but something a little uncomfortable, or we would never pay attention to it. So, what I try to do when suffering comes or something doesn't pan out the way that I feel it should, I try to find meaning in it. I go, okay, I really thought this was going to be a great fit and it's not happening and so forth. Maybe I need to walk away, or maybe I need to pivot, or maybe I need to reevaluate what I'm doing. It's sort of, for me, it takes the sting out of the unpleasant experience. Viktor
Mhm.
Frankl talks about that. It ceases to become suffering when it becomes meaningful. You
Mhm.
can find some meaning in it. And so this way, I know that something's going to come, but I'm not so afraid of it because I know there's some teaching and some learning and some growing that I can do.
Yeah. It reminds me of a book that I used when I worked in the hospital. I would facilitate the therapy group for the on the child inpatient unit for the psychiatric hospital, and the book is super. It's just a beautiful book. But what do you do with a problem? And I
Mhm.
don't know if you're familiar with that, Denise, but
Yeah.
it's a beautifully illustrated book, but it just follows this little boy who's got a problem, and it's kind of represented as this black cloud. And it just, as the book progresses, he tries to do all sorts of things to run away from it, to hide from it, to avoid it, and it just
Mhm.
gets bigger and bigger and bigger and
Mhm.
bigger. Um, so spoiler alert. At the
Mhm.
end, when he faces his problem, he discovers that within that problem there's an
Mhm.
opportunity to grow, to learn, to do something.
Mhm.
Um, and so that's, in a small way, um, what I was trying to do was introduce this other perspective on
Mhm.
suffering, on difficult things. All of these kids were in a hospital unit, right? Things were not going well. And in this moment, there's still an opportunity to grow, to do something, to
Mhm.
learn. And that's a beneficial thing.
Mhm.
Um, and so, reworking our approach to this means that when I face those things, that there's an opportunity here for growth.
Mhm.
And we never wish that on somebody. We never wish like, oh, I wish they would just have this really painful thing happen so that they
Mhm.
would grow through that. Um, but pain is going to come regardless, right? I
Mhm.
mean, that's kind of what you're saying. Like this is life, from a spiritual perspective,
Mhm.
looking at how our world is affected
Mhm.
by pain and suffering, and that just perpetuates it even more. Um,
Mhm.
it's going to flow into our life, right?
Mhm. Mhm.
But even those moments can be redeemed, can be um, made new in a way that we can grow in some
Mhm.
in some way.
Mhm. I don't think we would ever have compassion if we didn't have our own personal suffering.
Hmm.
And so
Mhm.
I realized that even though I don't want to suffer, that it just sort of puts me right back at center. And I realize, you know, I really need to reach out to more people who are suffering.
Yeah.
or struggling and so forth. And we get so busy when things are going well that we sort of just do our own thing and we get into our routine, but have tragedy and suffering come swooping in, and now we have a new perception of or perspective.
Hmm. And it has a way of realigning our priorities, I think, too.
Certainly does.
Um, I know that the challenges, yeah, they realign what we say. This is important,
Mhm,
and that word busy, boy, that's a tough word because it gets
mhm,
used so often. Um, by so many today, and I'm guilty of that too. But it's really
mhm,
a word that I've tried to eliminate from my vocabulary. I don't like describing things as busy.
mhm,
Um, I try and lean into this idea of fullness. Like, yes, life is full. There are many
mhm,
things, and I'm trying to bring intention into where I'm spending my time, who I'm spending my time with, what I'm spending my time on,
mhm,
because that's a finite resource, right? My time and energy.
mhm. Yes, I
Uh,
also try to avoid the word worry. I don't
mm,
say, "Oh, I'm worried about the," or I'll say maybe the concern could be or something,
mm,
and this is just another way of reframing it where it's not quite as harsh for the body to deal with.
yeah,
Busy to me, sympathetic, "Oh my goodness," rushing,
mm,
stress.
yeah, yep,
Full means plentiful, abundant, and
mhm,
yes, I mean, it could be busy, but it's also wonderful.
yeah, yeah,
Mhm,
yeah. These are, and whether it's the language that we're using, the perspective that we're taking, these small shifts, when we start stacking them together, really builds a different foundation for us to
mhm,
stand on.
mhm,
Um, so I'm curious too. You've used this phrase, mastering your
mhm,
emotions.
mhm,
And that really stood out to me. It kind of gave me pause, and I was being thoughtful about that. But I'd love to hear from you within the context of our discussion so far.
mhm.
When you think about mastering our emotions, what goes into that? What is that? I don't know. Define that for me.
Mastering your emotions, it's being aware of your thought patterns. Being because we think in the mind and then the emotions sort of come through the body. And if we're not aware of them, like anything, if we don't sort of keep up with the housekeeping, things are going to start to fall apart. And it's very important. Most of us are going through life on autopilot.
Mm,
They're not really thinking about how much they're drinking. They know that they drink because they've had a stressful day, but they're not really looking or why are they overeating? It's not they get that they overeat and if it fills something, but they're not really connecting. If we don't really master our emotions, the next thing you know, our vibrational energy of those emotions is going to be too low. And this is when these sort of not so great habits come out.
mm, mhm,
And I feel like if we don't spend time connecting and staying present and realizing and having awareness, we're not going to get to the point where we're doing good in the world.
mm, mhm,
Because good
mhm.
things we give to others when our cup is full.
Yeah, yeah. The hmm, the thing that came to my mind as I was listening to you and then thinking about this mastering our emotions is that it can seem like it's the opposite, where our emotions are actually our master, and
Mhm.
we're just doing to serve our emotions.
Mhm.
And when we can't even name our emotions or identify them, as you were referencing earlier, we don't even know what master we're serving then.
Very true.
Um, and that's where it can look like we're doing things on autopilot,
Mhm.
right?
Mhm.
But when our emotions are our master and we're in kind of servitude to them, that doesn't give us the opportunity to serve others in a fulfilling way. Because if my master, you use the word insecurity,
Mhm.
If I feel insecure in a relationship with somebody, and I think that the way of um, holding on to that relationship is by subjugating myself to them and serving
Mhm.
them in every way possible, then, then I'll feel secure, right? That
Mhm.
we're not actually serving the relationship. We're just
Mhm.
serving that feeling of insecurity. And
Yes.
that's a terrible taskmaster.
Yes.
Um, and so when you're describing this mastering of emotions, it's like our emotions can serve us, right? They can warn us when things are not okay or not
Mhm.
right, but they can also signal to us when we're on the right track too,
Mhm.
right? That sense
Mhm.
of fulfillment and contentment and security. But
Mhm.
until we're in the driver's seat, right? We're in that state of mastery over our emotions.
Mhm.
It's right. We're going to be fighting a losing battle.
Yes. One quick way of knowing when we have emotions, we watch our language. So if my emotions are not healthy, I'm stressed, I'm worried, I feel guilty, I'm overwhelmed. So I'm talking about me. When I'm around other people, maybe people feel bad for me because I'm stressed and I'm worried and so forth, but I'm pulling energy from them. I'm
Mm,
exhausting. Even though
mm,
they feel bad for me, it's draining,
mm,
and because I'm pulling too much to myself. When my emotions are more healthy, I'm compassionate, I'm loving, I'm joyful, I'm smiling at people. They feel that energy come to them, and it's fulfilling. It feels
mm.
wonderful. We
Yeah,
think of storybook characters that we just love because of their energy. And so when we want to master our emotions, we really have to decide, are we pulling or are we giving it out? Are we pushing it out so that other people are benefiting by them?
yeah, yeah. And I would imagine a balance there too,
Mhm.
um, because at the same time that we want to contribute to the joy and the contentment of others, there are times too when we need to seek um, support from
Mhm.
others, and we
Mhm.
do need to be real about pain or challenges that
Mhm.
we're facing. So how do you how do you coach people and or think through for yourself how to balance those two um, what kind of seem like opposing or conflicting
Mhm.
states,
Mhm.
but really both are, I don't know, holding both is important.
Yes, and certainly we don't wanna say, I feel guilty if I feel stressed or but what I want people to recognize is these feelings are obviously real because we feel them, but let's evaluate why do I feel stressed? Is it because 'cause I'm working so much and I'm not
Mm,
spending any time by, enjoying the things that I enjoy? Okay, let's make an adjustment. It's not something that we should feel guilty about. It's just something that we've apparently have overlooked, and now we're starting to feel stressed. We're starting to feel overwhelmed. It's not something again that we should feel shame about, but
mhm.
again, it's just indicating that we just need to make a little bit of a shift.
Yeah. And again, there's that acceptance, right?
Mhm,
Accepting like, oh, this is how I'm feeling, and it
mhm,
doesn't have to be how I feel forever, and I
mhm,
probably won't because feelings
mhm.
change like the weather.
Sure.
Um, but then I can do something about this
Mhm,
too. I can respond to this, and sometimes that is reaching out to others for support, for
mhm,
encouragement, for care. I That's because I hear the other side of this too, is that there are definitely um, kind of chronic complaining that can happen, but there
mhm,
are other times when it's like, I don't want to be a burden to others.
mhm,
I don't want to put this on anybody else, so I'm gonna hold it. I'm gonna handle it.
mhm.
I'm gonna deal with it. I'm not gonna share this with other people. And we really rob ourselves of the ability to connect when we don't share the hard stuff too.
Mhm.
So that's why I'm thinking, oh, boy, there's got to be this balance between these two that we're seeking.
Well, and this is why I love counseling
Mm,
because
yeah.
certainly I don't want to take all my problems and so forth and dump them on my husband or my sister or the kids. And but yet I have them and I want to talk about them. I want to sort of release them. Okay. So that maybe that's a good appointment for the therapist
Yeah.
to just sort of discuss, catharsis or talking is very healing.
Hmm.
But we have to be careful that we just don't grab anybody that will listen to us and dump our problems on them, which is really becomes unfair.
Yeah. 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 And I mean, that's such a beautiful segue into this, like what makes therapy, what makes counseling uh, important and valuable. And it's because
Mhm.
this is a space where we can bring those thoughts, those ideas, and get feedback on them,
Mhm.
problem solve around them, accept where we need to accept, change
Mhm.
what we need to change. Um, but we're not, it's not a dumping, right? Like, I know
Mhm.
that I can come into this space and I can do something productive with it,
Mhm.
because when it's only dumping, when it's only just venting out, oh, I felt so frustrated with this thing, or I'm so
Mhm.
unhappy with this thing, and then it just sits there, right?
Mhm.
It doesn't actually, nothing happens with it, and we
Mhm.
end up just kind of picking that back up and putting it in our backpack to carry around
Mhm.
with us till the
Mhm.
next person that we can dump that on.
Yeah. We just let a little air out of the balloon and then we go and fill it back up.
Yeah.
But,
Yeah.
a therapist will listen. I mean, a friend will also listen, but they'll likely
Of
just hold
course.
space. You know,
Yeah.
"Oh, I it sounds like you've really had a rough day. Sounds like that's really a tough problem." A therapist will say, "Gosh, it sounds like that's a tough problem. Have you considered,
Mhm.
things to do to sort of, again, put the nervous system back into balance so that you're not getting to this point where, your balloon's getting ready to pop?" So
Yeah.
I try to offer some tools to use and also listen so that
Yep.
maybe they can correct it on their own and not get to the point where they're so stressed out they can barely make it, to work
Mhm.
or get out of bed.
Mhm. 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 Yeah, and that's something that I've thought oftentimes about, is that if I can accept the person across from me in whatever state they're in, however they are in that moment, if I can accept them, that is one step closer to them being able to accept whatever it is that they're going through.
Mhm, mhm. I
Yeah,
agree.
yeah. Um, you were uh, happy to share some of your resources with me. I had a chance to review the couple of books that you sent my way, and you have
Mhm.
this really just endearing children's book that you've written
Do.
that is a nice illustration of a little girl that is doing well, but then is subject to life, and
Mhm,
some hard things happen, and this idea of I'm gonna see a counselor. I'm gonna talk about what's
mhm,
going on.
mhm.
Um, what was really the driving force behind you introducing this story and publishing that out?
This little girl is 7. Her mother called me after they were taking her to a chiropractor, a holistic physician, acupuncturist. I'm trying to think, they had her on a special diet because she was having a lot of stomach pain. Finally, they saw a coach, like a health coach, who referred her to counseling. And once we started to process a lot of her stomach pain, it was somebody was being mean to her at school. And when I
Mhm.
was talking before about how the body gets cued by the mind, and so mom would take her to school. She didn't want to get out of the car. My stomach. And so they were changing her diet. Yet again, all the dietary changes in the world were not helping the stomach because she was holding all of these experiences and it was coming out or manifesting in stomach pain. And as we started to sort of work through that, with children, they're malleable. I mean, she did really, really well, and
Yeah.
she wanted to tell her story. And so we did it together, and it's just a beautiful little story about
Hmm.
how it's okay to get help. She
Yeah.
did so well, and now she's starting to eat a lot of the things that she couldn't eat before, which is making her feel more connected to other people. She would go to a birthday party with her own food, and it's
Mm.
tough for a 7-year old,
Yeah.
but
Yeah.
it's a
No,
wonderful
I
little
just
story.
yeah, it is. It really is, and for me, I just in looking at it, I was like, wow, this just makes going to see a counselor just a very normal thing, a thing
Mhm,
that anybody could do, a thing that doesn't isn't scary. It isn't.
mhm,
Um, there's no stigma attached to it.
mhm,
It's just a healthy, helpful space to figure some things out.
mhm,
And I just loved the the book and really appreciated what you were trying to do through that story that
mhm,
you were able to share. So
mhm.
yeah, thanks. I think that book will probably live on my shelf now for a while. That I'll be able to share out because I think that is hard. It's not just asking for help, but it's going in, whether in person or virtually to see somebody. And I think we're doing a lot better, but steps like this, I think, are only helpful, especially for kids and families, to say,
Mhm,
"Yeah, like this is a good thing. We can go here. We can figure some things out, um, you know, and work
mhm.
together on it."
Mhm. One of the things that I had her do, because she would wake up in the morning and start with the anxiety, couldn't eat breakfast and so forth. So I had mom buy these children wisdom cards. So when she would wake up, she would start to pull a couple cards to just sort of get her grounded and get her centered, just to sort of get that shift to start.
Yeah. Yeah, because like you said, I mean, what we've been talking about, these patterns develop, and even yeah, for a 7-year-old, like very quickly a pattern can be established,
Mhm,
and it's automatic, right?
mhm, mhm,
And so, but we can do something about that. We can respond to it once we understand. And
mhm,
that's the other part here. What's actually going on? Because you know, those other helping professionals were looking at the situation
mhm,
through their lens.
mhm,
And it just took one person kind of stepping out and saying, well, what else could be going on here?
mhm,
Well, maybe
mhm,
this is more of a social emotional issue
mhm,
that's manifesting in a physical way. So let's look at
mhm,
it from that perspective. And again, I think that's when we take a holistic perspective, when we see everything in context, we're going to be much more adept at identifying with some precision what's actually happening here. and
mhm,
then and then
mhm,
once we name it, we can do something about it.
mhm. Yes, I agree. Yeah.
Denise, it's been so much fun getting to visit with you today.
It's
This
wonderful.
hour has just flown
Mhm,
by for me. I
mhm.
can't believe we're here at the end of our time together. So I just thank you so much for
You're welcome.
this really wonderful conversation, everything that you're doing for the clients that you serve, both locally and nationally. If people are interested in connecting with you, Denise, or getting access to some of the
Mhm.
resources that you've published, what's the best way for people to be able to do that?
Probably the easiest way is to go to my website, which is deniseschoenwald.com. Hopefully, you'll
Okay.
post that somewhere, so if
Yeah, I'll put all of this information in the show notes, so it'll be a single click away.
a few things available there. One is a quick 10-question quiz to assess your own mental health. And so that's something that doesn't take a lot of time. A lot of people enjoy doing that. I will contact them after the quiz, but I will not call or
Mm.
push or anything like that. The second step is if someone who's listening would like a copy of my book, they can contact me through the website. I'd be happy to mail them a copy of a book, something that I
Awesome.
feel might be helpful for them. And certainly, if they'd like to make an appointment, that's available online also. They can just pull up my calendar, be happy to see them. Counseling is a gift that we give to ourselves.
Yeah.
So I encourage everyone to have a counselor for
Yeah.
some
Yeah.
for the tough times in your life and the times you just need somebody to process situations and emotions with.
Yeah. Yeah. Absolutely. Absolutely. Well, I will, like I said, I'll put those links in the show notes. If folks are interested in connecting with Denise, please go there, access those resources, take that little self assessment. Anytime we have an opportunity to learn a little bit about ourselves, that's just a beneficial thing. So,
Mhm.
Denise, I wish you the very best. Thank you
You.
again so much for coming on the Well Mind.
You're welcome.
Thank you, Denise, for joining me and sharing your expertise and insights with the WellMind community. And many thanks to all of you for spending your time with me today. If you enjoyed our conversation, please check out previous episodes, click rate and subscribe through your podcast app, and let people know about the WellMind podcast. Share the episode with someone you think might enjoy giving it a listen. Also, be sure to check out the links in the show notes for the resources from our conversation today. Many thanks, as always, to the staff here in the Bethany Lutheran College podcast studio. You do so much to make the Well Mind a reality. Thanks again for listening, and until next time, be well.